My name is Darielle, and I am an ethical consultant. I was invited here today to oversee the ethical dilemma meeting. My job here today is just to ensure that all party sides are being heard and to determine the plan of action for the next step of this case. Now, today in this meeting, we do have Mr. Abdul's wife, who is also the substitute decision maker, the patient's Muslim spiritual leader, the patient's bedside staff nurse, the nurse manager, the physician, and then myself, the ethical consultant. Today, we are trying to work towards resolving the issue of who decides whether it is useless or not to continue care of a patient that has been declared brain dead, as well as should physicians have the option to end treatment and remove life support against the patient's family wishes.
Wife's current emotional condition has her in a closed-minded state. However, she is willing to listen to the doctors who hope they can clarify futile care and allow Abdullah to pass in a comfortable, pain-free manner while following the guidelines set out by the family's spiritual leader. The wife of Abdullah is distraught at the thought of losing her husband. She relies heavily on the male family members and her spiritual leader for guidance and has requested that they be a part of the meeting. The doctors have previously explained that their position regarding continuing care for Abdullah would be futile, but her understanding of this is limited and she needs clarification before moving forward. She understands by law that she is her husband's substitute decision maker and that her wishes and decisions are to be respected as per common law in Ontario and the Healthcare Consent Act. She firmly states that in this meeting, she knows what her husband would want and wants to ensure she does everything possible to save him according to her faith. Due to her emotional state, unwavering Islamic faith, and language barrier, there is uncertainty regarding what treatment should be provided. She believes that Islamic teachings do not specifically address removing life-sustaining measures, such as a ventilator, if the treatment is ineffective in improving Abdullah's quality of life. Maintaining the ventilator will give her and her children more time with their husband and father. Nonetheless, she still believes her husband will survive. Furthermore, according to Islam, it would be a sin for her to deny the possibility of a miracle with God's help, who she believes is the ultimate healer. Yet, she looks to her spiritual counselor for clarification to ensure she follows the Quran.
Life and death are believed to be of Allah, and He predetermines the timing of death. The Muslim faith believes that death is the termination of all worldly life you see in the passing into the afterlife, which is the ultimate destination of all believers. When Mr. Abdul passes, his soul will leave his human body and live on in the afterlife. After Mr. Abdul's soul has left his body would need to be prepared for a ritual burying. If family friends are not present when Mr. Abdul's soul leaves his body, the nurse on duty would need to close his eyes and cover him until his family arrives. When the family arrives, they will perform a ritual wash of his body and recite the final prayer to him. There is some debate regarding the diagnosis of brain dead in the Islamic scholars. Most scholars accept the diagnosis of brain dead as the body's true death and the soul entering the afterlife. However, some scholars still believe that the cardiopulmonary criteria is only determines their true death. Now, Islamic law does allow the removal of ineffective treatment. In this case, it will be Mr. Abdul's ventilator as well as feeding tube. Removal of useless treatment is only permitted for patients that are deemed terminally ill with death beginning in the immediate future. Removing life support will allow death to take its natural course. The Muslim faith states that if three physicians' medical recommendations align with one another, saying that irreversible brain damage has occurred, then life-supporting measures are deemed useless. After three physicians' medical diagnosis aligns, it is believed that the patient's or the family members' opinions of withdrawn life support are not relevant, as they don't have the power to or the capacity to reach a different medical decision. The family should accept this decision as being of Allah's decree and find comfort in the fact that Mr. Abdul will be rewarded in the afterlife. It is still essential that Mr. Abdul's physicians and nurses during this time still explain the entire situation to the family.
Both physicians are highly regarded neurologists. They have taken all measures to reach their decision regarding Mr. Abdul's current state. They have concluded that his level of brain damage, including the brainstem, is irreversible and have declared him brain dead. The family has been informed and the physicians understand that the prognosis is not what they had anticipated. Medical advancements have had a significant impact on the ability to prolong life, and physicians have a greater moral obligation to make ethical decisions in implementing, withholding, and withdrawing life-sustaining interventions. They also have a moral commitment to the purpose of medicine, which is to cure, relieve symptoms, improve function, prevent sickness or premature death, avoid harm, or alleviate suffering around the time of death. The physicians believe that prolonging Mr. Abdul's life is not considered a goal of medicine and believe that the patient should be taken off life support and change the course of treatment to palliative care until Mr. Abdul's body naturally ceases. In fact, interventions that prolong life are believed to exacerbate the suffering and hinder the ability to provide a dignified end of life. Therefore, it is against their moral obligation to continue with mechanical ventilation and tube feeding, knowing the undesirable quality of life that Mr. Abdul will have to endure. The conflicting values from the physician's perspective are respect for life and client choice. Although healthcare practitioners pursue to improve patients' state of health, they also believe that treatments that aim to prolong life at any cost are inappropriate. The physicians respect Mr. Abdul's life, and ending life-sustaining interventions will relieve him from any further torture. However, the one impeding factor is Mr. Abdul's wife's inability to accept his prognosis and look into palliative care. Mr. Abdul did not have any advance directives, and his wife was automatically appointed the substitute decision maker. Client choice is a value that affects the physician's point of view, and they must obtain consent from Mr. Abdul's wife to withdraw all life-sustaining interventions. As the SDM, her wishes must be respected. The two main principles involved in the physician's positions are non-maleficence and beneficence. With non-maleficence, they have a moral obligation to do no harm. After concluding that Mr. Abdul is brain dead, they understand that maintaining him on life support will only prolong his death, which will only cause more suffering. Beneficence requires an individual to produce goods for the benefit of others. The physicians both agree that the removal of life support is in the client's best interests. Changing his course of care to palliative therapies will provide him with the utmost dignified end of life.
The bedside nurse is a new grad with only 1 year of experience. Her practice is guided by a strict code of conduct that helps her provide non-judgmental, holistic care while respecting and acknowledging the family's emotional, spiritual, and cultural needs. Because of her limited experience as a nurse with Futility and the Muslim faith, the nurse has consulted with her nurse manager for guidance. With the support of the nurse manager, the bedside nurse has reflected on her oaths of non-maleficence and beneficence and what that means for the patient. The nurse believes that continuing care would inflict unnecessary pain and suffering for the patient, and this does not align with her principle of not doing any harm, and this is not in the patient's best interest. The challenge for the nurse was reflecting on her moral position on whether life-sustaining measures would continue when the prognosis is futile. The nurse empathizes with the wife and the family's wishes to sustain life and believes they remain hopeful due to a language barrier which has caused miscommunication. The bedside nurse has recognized a gap in the understanding of futility for the wife and has recommended that she gain clarity before making any further decisions. Therefore, she cannot support the withdrawal of life support at this time until the family has a full understanding of Abdul's prognosis. The nurse believes a translator must fully communicate to the family the doctor's reasoning of futility to continuing care. Two theories that are applied here are the utilitarian and deontological theories. The utilitarian theory guides ethical decision-making by producing the best outcomes for the most significant people. According to the utilitarian theory, keeping Mr. Abdul on a ventilator and feeding tube would be the correct choice. Mr. Abdul would be kept alive, his wife's wishes would be honored, and the Muslims' beliefs would be valued. The wife and the children can also remain at the client's bedside as a family unit. Mr. Abdul has deteriorated significantly and will not regain consciousness. According to the deontological theory, the most favorable decision is based on the moral obligations regardless of the outcome. Many healthcare providers are against interventions that maintain life when the qualitative value is compromised. In this scenario, the physician's moral duty is to withdraw the medical treatment, minimizing the suffering and providing Mr. Abdul with a dignified life until death despite the family's beliefs and wishes. When the decision is made, the nurse will seek guidance from the family's spiritual leader concerning cultural and religious practices and her role in caring for the patient during the active phase of dying and immediately following the death.
The nurse case manager has been a nurse for over 20 years and has always been a strong advocate for patients and their families. She understands and respects the family's values and religious beliefs in wanting to maintain Mr. Abdul's ventilator and feeding tube. However, she also believes that sustaining life creates a burden on healthcare resources when the patient has minimal to no chance of recovery and returning to a meaningful life. The two physicians caring for Mr. Abdul have concluded that he will not regain consciousness, and as a result, she believes that treatment is no longer beneficial and is only prolonging death at this point. The nurse case manager values the respect for life and that providing a dignified death is a priority, and that would mean removing life-sustaining interventions and relieving the patient from pain and suffering. The other two values that tie in together are client choice and maintaining commitment to clients. Despite the beliefs of the nurse case manager, she understands that Mr. Abdul's wife is the appointed decision maker and she would have to consent to the removal of life support, and her decision must be respected. The nurse case manager also understands that bedside nurses must continue to maintain their commitment to the patient and the family, respect their religious beliefs, and refrain from abandoning or neglecting the client, even if the views conflict. The principle of beneficence is relevant to the nurse case manager as it represents doing good for the benefit of another. She believes that removing life support, as per the physician's recommendations, would be more beneficial for Mr. Abdul. The goal of care should be providing a dignified end of life. Furthermore, the removal of life support would decrease futile medical costs and increase the accessibility of healthcare to those who have a greater chance of recovery. The other principle is fidelity, and as a nursing leader, she understands that nurses are committed to patients, acting in their best interests, and respecting their wishes.
Before I decide on the next best course of action, I will summarize the important points made in this meeting. This is to ensure that no information was missed and that all party sides was heard. So from the Muslim spiritual leader, they believe that Muslim faith believes that once a patient passes, their soul leaves their body and enters the afterlife. Once the patient passes away, their body will be prepared in a ritual burial, for a ritual burial, which includes the ritual washing of the body and the family reciting the final prayer for the patient. In the event that that the family isn't there, the nurse on staff will need to make sure that the patient's eyes are closed and the body is covered until the family arrives. Islamic law does allow the removal of useless treatment if the patient is deemed terminally ill, as well as if 3 physicians state that Abdul's brain damage is irreversible. Then according to the Islamic law, life support can be removed. After 3 physicians make their medical diagnosis and recommendation, the patient's family members and the substitute decision maker opinions on withdrawing life support are now deemed irrelevant. And it is also essential that the physicians for the patient and the nurses explain the entire situation as it goes on to the family during every step. Now, from the bedside nurse, we heard from you that the staff nurse is that you're experiencing the feelings of confusion. You understand delaying the removal of life support prolongs the patient's death, which will be painful for the patient. You are currently in a moral dilemma because the substitute decision makers desire to go against your ethical principles of like non-malice, as well as you morally, you believe that the wife does know what is best for her husband and what her husband would want. The nurse case manager here today. Now, you stated that you understand and you respect that the substitute decision maker values and religious beliefs drive her to want to keep the life support machines on. You believe that sustaining life after it is deemed that the treatment is useless creates a burden on healthcare resources. And due to the physician's medical recommendation, you also believe that treatment is no longer beneficial and only prolongs the patient's death. Now, the physician that was here to speak for all physicians so far. So collectively, you guys have taken all measures, completed all tests, and saw all treatment options before deciding on Mr. Abdul's current state. The level of brain damage Mr. Abdul has suffered is irreversible, and therefore you have deemed him brain dead. You informed the family of the diagnosis and believe that the patient should be taken off life-sustaining interventions. And you would like to focus the treatment once the interventions are continued, you would like to focus your course of treatment on palliative care until Mr. Abdul's does pass away. And as well, you also state that it is against your moral obligation to continue life-sustaining interventions, nor the undesirable quality of life that the patient will endure. And last but not least, here we do have the wife, Mr. Abdul's wife, and that you stated that you are of the Muslim faith and devoted to Islam. You strongly believe that Allah cures even when the physicians believe against it, and that state that this case is hopeless. You know what your husband would want as you are married to him. Your extended family members also play a vital role in the decisions about the patient's case. You're following the writings of that's in the Quran, as well as it is important to feel heard and that your wishes are respected. So now with all that being said and nothing was left out, I will go ahead and give my recommendation. So as the Muslim spiritual leader did state, if three physicians recommend medical recommendations align with one another, stating that the irreversible brain damage has occurred, then it is to believe in the Muslim faith that life support measures are deemed useless. Therefore, I recommend a third independent physician examines the patient and provides a professional recommendation on Mr. Abdul's condition and whether or not life-sustaining measures should be removed. Now, during this time, while we are waiting for the patient for the recommendation, the family will have time to spend with the patient and possibly say their goodbyes in the event that he does pass away before our next meeting. It'll also give the family time to reflect on what the first two physicians' recommendations was, as well as prepare for any cultural tradition surrounding death. After the physician's recommendation is received from the third physician, all parties will attend another ethical meeting. Now, during this next meeting, we will discuss the recommendations that the physician made, determine if anyone's opinions or recommendations have changed, or they feel the same about removing life support. And then after everyone's arguments and opinions are heard at the next meeting, I will make another recommendation based on the findings. Thank you.